In today's video, I'm going to be discussing which skin treatment affects which layer or which concern. In the marketplace, we're hearing about chemical peels or vampire facials or laser resurfacing, and it gets very confusing to the consumer as to which treatment affects which layer. So we're going to talk about texture of the skin, we're going to talk about the color, and we're also going to talk about volume. So these three things, this is what we really need to look at before we decide which treatment is going to work on that concern. Hi, I'm Becky Wilkins. I've been a registered nurse for over 30 years now, and I've been building my business here at External Affairs Medical Spas for the last almost 25 years. My family started this business many years ago. Our specialty is beauty and regenerative medicine, which means that not only do we want to help people look and feel great on the outside, but we also want to start on the inside and really look at things like hormones and nutrition and all of those things that go together. The purpose of our videos is to educate people better when it comes to these procedures. So many clients have fears, and by producing better content, we're hoping that we can alleviate some of those fears. We really appreciate your feedback, and we want to know what you want to know. So please pop your questions in the comment section below, and we'll make future videos to address your questions. So here is a diagram of the skin, and we've got three layers that we're usually looking at. So we've got the top layer, which is called the epidermis, and that's the layer where we've got our dead skin cells. That's the layer where pigment lies, right below that dead cell layer. Obviously the hair follicles and the sweat glands come through that layer. Then the next layer is called the dermis, and this is where we're getting into live tissue. So we've got blood vessels that run through this layer. We've got the base of the hair follicles. And really importantly, this is the layer where we have collagen and elastin fibers. Then we come down, and the very bottom layer of the skin is called the subcutaneous layer. This is the layer where we have fat cells that sit above the muscle layer. And then of course, we've got bone down here. The thickness of this skin really depends on the area on the body. So for example, on the eyelid, this is 0.5 millimeters thick, whereas areas like the heels or the palms, it can be up to 4 millimeters thick. So when we're looking at skin treatments, this is what we need to address first, is where does the problem lie? Is the problem lying in the epidermis? Is the problem in the dermis? Or is the problem down below? So on our diagram where we talk about texture, color, and volume, each treatment kind of falls into a certain layer. Quite often, if people are coming in and they are concerned with the texture of their skin, usually that's a problem with the top layer. Usually there's too many dead cells that need to be removed. That would make it smoother. Sometimes muscle contraction, so a repetitive movement like squinting or frowning, it doesn't necessarily affect the dead layer because it's actually the muscle that's causing it, but it can create permanent divots in that top layer. When we're looking at treatments like chemical peels, microdermabrasion, dermaplane, those are the three treatments really that focus on that dead cell layer. So I'm going to show you what that looks like as to how to get that off. Our dead skin cells, they kind of stack up like bricks on top of the skin, and they're held in place by this molecular glue that kind of sticks them together. So if we're doing something like a chemical peel, for example, the chemical that's used on the skin, and it could be a glycolic acid, it could be a lactic acid, it could be a modified Jesner's peel, it could be salicylic acid. The different acids have a different effect on the skin, but basically what they're doing is they're kind of breaking that bond that holds those dead skin cells in place, so that the dead skin cells can come off at a faster rate, like that. In the case of acne or clogged pores or blackheads, we have kind of a compounding problem. We've got a dead skin cell layer that's congested. We've also got congestion in the pores underneath the skin. So we all have pores in our skin, but people that are prone to oiliness or acne, they get sort of like this congestion in the pore. So their body might be producing extra oil, like in the case of teenage acne or hormonal acne for women. So they get this extra oil being produced in here, but then there's actually dead cells in the pore that also stick together. Now we all have bacteria in our skin called the P. acne bacteria, And for people who are prone to acne, they get this flare up because that acne will feed off of this, I call it sludge, combination of oil and dead skin. So an acid like salicylic acid does a beautiful job of getting into that pore and basically cleaning it out. So in the clinic, we do salicylic acid peels, but of course we suggest for home care salicylic acid as well. It has an anti-inflammatory effect, which can also reduce the redness in there. In the case of sort of an aged skin, if we want to get the dead cell layer off, then we're going to choose a different chemical that's actually going to be hydrating, like lactic acid or glycolic, as well as exfoliating. If we are using something like microdermabrasion or dermaplaning, we're actually using a physical means of basically kind of removing that dead cell layer. So it's like a scraping, okay, that actually removes it so the skin feels much, much smoother, products absorb better. The thing that I really want to emphasize is that we really are just working on that top layer. So that kind of covers the epidermis. So in the category of texture, but sort of like at a deeper level, so maybe getting down into the dermis. So skin that's got fine lines, wrinkles, maybe larger pores. The problem is coming down a little bit deeper. So we still may do an exfoliating procedure, but we're going to be a little more aggressive and go a little bit deeper. So now we're talking about procedures like microneedling, with the vampire facial, or maybe CO2 fractional resurfacing. Now we're going to use either a laser or a microneedling pen to actually penetrate little tiny columns through that layer of skin to create almost like little tiny wounds. And that process stimulates the body to shed the outer layer but produce new collagen. So we're actually affecting a little bit deeper now. When it comes to those procedures, the deeper you go, the more heat that you put in, you're going to have an increased effect on those collagen and elastin fibers. So quite often people can't do the downtime, and that's fine. They can do the less aggressive procedures, but they may need to do more of them. So it's important to understand the difference between treating just the top layer and actually penetrating down deeper into this dermal layer here. So when we're using a product like Botox or Dysport, those medications are considered neuromodulators, and what that means is they affect the ability of the muscle to contract. So we see the end problem on the top layer of the skin. Like I mentioned before, if you've got like this little fine wrinkling starting, but it's with muscle movement. So that's where we know if that product is going to work. If the fine lines and wrinkles are being caused by a contraction of the muscle, like the frown, for example, or squeezing the eyes, then we know that we can treat it with Botox or Dysport. So we're actually injecting the muscle, but it smooths the top layer of the skin. So now we're going to talk about color of the skin. Procedures that treat the color of the skin are either going to be things like photofacials, or possibly chemical peels in a darker skin, or sometimes we'll actually use something like electrocautery to basically burn off, any little texture bumps. So typically pigment is in the epidermis of the skin. So when you think of pigment, you want to think of like a tan is the body producing extra color, extra melanin from the melanocytes, and it's actually a protective mechanism. That's what a tan is. We all look so healthy, but it's actually sun damage. Your body's trying to protect itself. Now when we start to see like darker spots, on the face, which typically appear later, your 30s, your 40s, your 50s. The skin is trying to protect itself from the sun, and it's producing these clusters of pigment. And that's typically what we'll see, when we do the vector camera, we'll see those extra pigmented spots. One of the best ways to treat those is with a photofacial, which uses intense pulse light, or IPL. Now that type of laser actually penetrates through the top layer of the skin, and it's absorbed by this extra melanin. From here, they actually darken, and then they'll come to the surface and slough off. Sometimes people get like a wow result with one treatment. Sometimes, 2 or 3 treatments is required. And then maybe annually, if they're continuing to go to the sun to get the sun damage. The other thing that a photofacial treats is the broken blood vessels. Again, that can be from sun damage, but it also can be part of the aging process. Women are prone to, once we get to menopause, our body just we get these dilated blood vessels everywhere, and so the photofacial works beautifully on that as well. Chemical peels can also be used to treat pigment, but it requires multiple treatments. Sometimes we reserve that treatment for somebody who has a natural darker skin, which makes them a poor candidate for a photofacial because the photofacial, that light energy is attracted to color. So if a person has naturally dark skin and darker pigmented spots, that laser is going to heat them up too much, making it an unsafe treatment. So we can do a series of chemical peels for the clients with the darker skin, and just by forcing the skin to exfoliate more, we gradually will pull up some of that pigment to get a nice, more even color. Now, if somebody's got a pigmented spot or even like a raised bump on the skin, we can zap those off with a procedure called electrocautery. We do want to make sure that any little lumps or bumps are not precancerous, so we have someone from our medical team check that out prior to burning those off, but basically that works great on getting those little things off. So we're going to talk about volume loss now. Volume loss in the skin can start, as early as your 20s. And basically what's happening, if you think of your skin like a mattress, okay, where the epidermis is kind of your sheets, the middle layer is maybe that memory foam layer, and then your subcutaneous layer where the fat is, that layer is more like the actual mattress. So what happens is, first of all, the epidermis gets thicker, so we need to thin that out. The dermis gets thinner, and as we lose volume in this area, it affects the texture on the top. And then also with subcutaneous fat, we actually lose fat as we age in the skin, or the fat pads drop. The other thing that happens is we actually lose muscle underneath the skin as well. And then to top things off, our bone starts to shrink. So as we get older, we've got sort of like multiple things happening in the skin. So when we're addressing volume loss, one of the number one ways to correct that is with the hyaluronic acid fillers. So products like Restylane, Juvederm, Belotero, there's multiple products available in Canada, but basically they are hyaluronic acid molecules, which we make that in our bodies. It's in our eyes, it's in our skin, it's in our joints. The way we make it, it's very liquid, it's watery, and we metabolize buckets of it every day. When the products are used for cosmetic injections, they are altered, in the manufacturing process, and they add cross-linkers to turn them into a gel, so that if they're injected into this dermal layer, they actually will provide volume, they absorb water, and they'll stay put anywhere from 6 to 18 months, depending on the area. So that's how we correct this volume loss into this dermal layer. Now, there are other products on the market. Sculptra is a good example. Sculptra is a poly-L-lactic acid molecule that stimulates your own collagen. So it can be also injected into this layer, and it'll actually stimulate those collagen fibers. And we see results with that product up to 2 to 3 years. It's a very soft, natural look. I particularly like Sculptra for our patients who just have like an overall thinning of the skin, and it's maybe not filler, is the best choice for them. Our clients who are extremely athletic and have very low body fat, our runners, our soccer players, those types of clients do very well with Sculptra. Another product on the market is called Radiesse, and that's actually a calcium hydroxylapatite that it'll stimulate calcium, that collagen buildup as well. Also takes, a few months to see the result. It can provide a nice extra volume. We typically use Radiesse in areas where we want a little bit more of a contoured look, in particular the jawline is the most popular. So when we're talking about skin treatments to work on volume, one of the really only treatments available out there to actually stimulate, these deeper layers is something called Ultherapy. That is an ultrasound device that goes through the skin, and it superheats to a point where it causes a thermal injury, and that stimulates new collagen. So with the ultrasound device, with the Ultherapy, the technicians can actually see the layers of the skin, and they've got sort of this target layer where the collagen fibers are lying, and they will heat that tissue up to between 60 and 70 degrees Celsius. And over the course of the next 3 to 6 months, we're going to see a slight volumizing of that. In our clinic, we typically do it in combination with either the fillers or the Radiesse, just so that we can kind of speed the process up. But Ultherapy is a great treatment for getting down really deep, but safely. So EA Beauty is our method of really helping our clients identify, first of all, their concerns, and then really matching the correct treatment to address those concerns. We have our new EA Beauty workbook, and we'll include the link. You can download it and really even start to identify for yourself where your areas of concern are. And that way, when you come into the clinic, you've already got that established, and then our technicians can take over and help you identify which treatment would be the best for you. If you enjoyed this video or found it helpful, please hit the like button, share it with your friends, subscribe, and hit the notification bell. And don't forget to leave us comments or questions down below so we can get to know you better.